Hey guys, wanted to run you through something I go through with a lot of my patients regarding pain, injury, and the whole rehab process and getting back to 100%. So this is what I call the T3 model. And you've got trigger, the trickle down effects, and you've got today's trouble. So I'm going to start over on this side. So typically people are coming in with pain complaints, which is important because it does give us some information. However, almost more importantly is working back up this way. And so typically when I'm working with folks, what we'll start with is we'll start with the pain complaints, but then what we'll do is we'll actually work our way back into this trickle down area. Now this is where I find that there's a lot of help and work that needs to be done to make sure that the issue that you're having doesn't come back. And so there's three main things that we generally look at. So in this trickle down effect, we're going to look at something called fear avoidance. If you break that down into two words, you've got fear and you've got avoidance. This is really typical when you have a particular injury and there's a fear of doing something that's going to hurt again. And there's also an avoidance piece where you might actually avoid certain motions because it hurts. And this all makes sense from a perspective of you want things to get better. However, if you keep being fearful and you keep avoiding things, essentially you're not going to do things because you're fearful to do them. And so one of the ways and one of the things that we have to do during rehab is to make sure that we address some of these things. Number two is compensations. We see this a lot with low back pain as well as neck pain. So for instance, when someone has a history of neck pain, what they'll do is they'll tend to rotate their entire body to look versus just turning their head, because that's a compensation. Same thing with low back pain. And instead of just bending over normally, what they'll do is these folks will just tend to keep their back straight and do one of these. You may have seen these people. And this is one of the keys that we need to address in making sure that someone gets back to 100%. Thirdly, deconditioning. Essentially what that is when you have an injury, a lot of times people will rest for a few days, and resting for a few days turns into a week, and then it turns into 2 weeks, and then it turns into a month. And so what we want to make sure that we do is not only are we certainly concerned about the pain piece, but we're also getting people back in shape and getting their muscles and their ligaments and their tendons back to the robustness that they need to be to function back at 100%. So this is just a little bit of a rundown on what we do here. And again, certainly we care about the pain. That's what's driving care usually. However, we want to start to look back and say, what are some other things that might be contributing to all of this going on? And certainly there can be an initial instance as well. And so that's what this trigger is generally there's some sort of injury that happens initially, and that essentially starts the trickle down effect and then brings someone in to the office or to seek care. So I hope this was helpful covering the T3 model. Let me know if this resonates with you and if this is something that you're dealing with. Have a good day, guys.